This is a story of a patient who almost died due to a lack of access to medical care by health authorities in Australia. It started with what appeared to be a harmless tick bite. A round red rash, known as an EM rash, appeared at the site of the tick bite. A week after, the tick was safely removed, alive and in its entirety, before being flushed down the toilet. Patient X had no idea what that red mark meant, and even if they did, it wouldn't have mattered. In the days that followed the tick bite, Patient X had significant flu symptoms, but so did many people in the winter of that year. There would be no more symptoms for 6 months, as the infections from the bite quietly multiplied throughout Patient X's body. One of those infections was Borrelia, commonly known as Lyme disease. The incidence of Lyme in Australia is not known, as no statistics are kept by the medical authorities. No count equals 0 cases, which means the existence of this potentially fatal infection can be denied. Even if the patient had been aware of the risks of this infection and sought treatment, with proof of infection indicated by the EM rash, they would still have been denied access to urgent medical care. Such is current government policy. Medical authority pressure also prevent doctors from testing for, hence treating, this dangerous infection. Under the current government policy, patients are not allowed to be tested for Lyme disease, unless they've travelled overseas to Lyme disease endemic areas. It's a medical merry-go-round. A confirmed Lyme disease diagnosis requires epidemiological evidence, despite the fact they don't count cases in Australia, so we don't have epidemiological evidence recorded. The consequence? The patient was left completely abandoned and almost lost their life. Lyme disease and its co-infections can present as hundreds of different symptoms as the infections invade multiple body systems. Had diagnosis and treatment been provided early, chronic infection would likely have been avoided. Patient X is now not only in a long-term battle against this potentially fatal medically denied illness, but they're also in a battle to be treated fairly under the Charter of Australian Healthcare Rights. Patient X is not alone. This, put simply, is an Australian medical failure.